Next, we have Dr. Scott Pearson from Edina Health. He'll be talking about medication considerations for patients with aortic disease. Dr. Scott Pearson is a clinical pharmacist with Abbott Northwestern General Medicine Associates, where he practices at the Edina West location and provides comprehensive medication management for patients in a hospital-based internal medicine clinic. He completed his doctorate of pharmacy training at the University of Wisconsin-Madison School of Pharmacy, followed by 2 residencies at the University of Colorado. His practice, research, and teaching interests include cardiology, diabetes, geriatrics, and transitions of care. A huge thank you to Dr. Pearson for giving valuable insight into the whys of our medication and an understanding of that hidden layer of care at our doctor's office that supports our health. Please welcome Dr. Pearson.
All right. Thank you all so much. So from a pharmacist perspective, really my goal for this talk today is just to hopefully give all of you a little bit of a better understanding of a number of these medications that we commonly see in the management of aortic diseases. And so, let's see here. As far as kind of an overview, we'll kind of specifically touch on 2 particular populations. So we'll talk about people with more of this aortic aneurysm, as well as also kind of touching on more of the valvular component in people who have had an aortic valve replacement. And just for the sake of time, a lot of this will be a little bit kind of broader and a more general overview, but definitely happy to answer any more specific questions later on throughout the day as well. So to kind of dive in first, in terms of looking at aortic aneurysms, I think this is a lot of material that you guys are all familiar with and have heard in different pieces today already, but essentially when we talk about this aneurysm, it's kind of just a bulge in that aorta that, in many cases is related to plaque buildup over time. And the reason why we really care about this is because, as you've heard throughout the day, as these aneurysms grow, they can lead to a rupture or dissection, which is a medical emergency and something that really we want to kind of do anything that we can to try to prevent. And so when it comes to this management, as you've kind of heard as well, when these enlargements become much more significant, that's generally when we're looking at surgery. But in the earlier stages, when it's a little bit more of a minor enlargement, generally more what we're looking at is just kind of surveillance and watchful waiting and really trying to just prevent any further kind of expansion of that aneurysm. And so when we look at this, a number of pieces that we'll kind of touch on. So blood pressure control is going to be very important here, just when you think about the pressure of that blood that's pumping through the aorta. As long as we're kind of keeping that at a reasonable level, that's going to help to prevent some of that further expansion. And when it comes to blood pressure goals, generally, we're looking at least a goal of less than 130 over 80. In some cases, we might even be a little bit more aggressive than this if people can tolerate it, but that's something we'll talk a little bit more about. From another medication standpoint, statins are something that we'll also talk more about, in particular when there is kind of a plaque contribution to these aortic aneurysms, something that can help to reduce some of that plaque formation. And then a couple of things we want to try to avoid. So tobacco is certainly a risk factor in itself of just having this aneurysm develop, certainly not the only risk factor, but one that if people are using tobacco, we really want to do anything we can to try to get them to quit. And certainly from a pharmacy standpoint, we have medications that can help with that that we won't get into now, but certainly that's a big risk factor management piece. And then the last one here, I think this is an important one that, again, when we think about some of these advocacy points that have been made earlier, I think is a really important one for you all to be aware of. So there is a medication class called fluoroquinolones. They're a type of antibiotic. It would include things like ciprofloxacin, levofloxacin. And these antibiotics in people who have an aortic aneurysm, there's actually some evidence that they may somewhat increase the risk of having a rupture. And so, it's not an absolute that we can never use these in someone with an aneurysm, but definitely something we want to be thinking twice about. And so especially if you're getting care in, say, an urgent care where they maybe don't know your whole history, just kind of important to have this in the back of your brain and make sure that they're aware of this as they're making decisions. All right, but to dive a little bit deeper into blood pressure management. So as noted by our previous speaker, beta blockers generally are going to be one of our first go-to options when it comes to blood pressure. So get into kind of the alphabet soup of medications here. These are kind of our OLOL ending medications, so metoprolol, carvedilol, atenolol, if you guys are familiar with any of those. So the reason why we really like these in the aortic aneurysm setting is that in addition to lowering blood pressure, they're also going to be working to decrease the heart rate And also, by doing that, they also reduce some of the pumping function of the heart and some of that contraction of the heart. And by doing all these things, really what they're doing is, again, kind of working to take some of that pressure off of the aorta as blood is pumping through. So in general, that's going to be one of our first go-to options. Beyond that, I'll say, again, when we're looking at blood pressure goals, really any of these kind of other blood pressure lowering medications can be great options. Love, as our previous speaker mentioned, I think an exciting area, thinking about specific nuanced situations where we might prefer one medication as opposed to another, which we could probably have a whole nother talk about. But big picture, we're worried about that blood pressure number in itself, and generally, other medications that are lowering blood pressure, all great options. And so a few things just when it comes to monitoring of blood pressure that I think are important just to kind of be familiar with. So, with any blood pressure lowering medication, certainly possible that this can lead to some lightheadedness or dizziness. And especially with changes in position, this is something we can commonly see, or if we happen to be lowering blood pressure too much, these are things that people can experience. So especially with any of those changes in position, trying to avoid jumping right out of bed, kind of just, again, kind of taking time with any of those changes. In addition to that, when we talk about beta blockers, something a little bit more specific to those medications is that especially when people first start these medications, fatigue is fairly common. And for anyone in the room who's started one of these medications, you may have experienced this. So I bring this up because it is something that typically will improve over time, just as our bodies kind of accommodate and adjust to having this lower heart rate. Typically, as long as it's something that is manageable, over time it is something that will become just kind of more common and less of a concern typically. And the last thing I bring up here, so home blood pressure monitoring, especially as we're working to get blood pressure under control. This can be a great piece as well. As you all know, when you drive in through the ice and snow and come into the doctor's office, very common that your blood pressure is going to be a little higher. So nice to have some of these readings at home as well, just to give us an idea of how you're looking in the big picture view and not just looking at that 1 or 2 points in time that may be different. All right, and kind of last slide I wanted to touch on here related to statins. So these are medications that lower cholesterol levels, but what they're also doing, and kind of more specifically what they're doing, is they are reducing some of that plaque formation that can occur within the arteries and within the aorta. And what they also do is they work to kind of stabilize some of those plaques that are already there. And why this is important is when those plaques break off, that's what can eventually end up leading to either a heart attack or a stroke. And so, when we look at people who are at higher risk of things like heart attacks and strokes, that's why these statin medications are so widely recommended and why they have so many benefits just at helping to reduce things like heart attacks and strokes. And so with that, again, because in many cases plaque formation can contribute to these aneurysms, that's why there is some also thought that these statins may help to kind of slow some of this aneurysm growth. So in many cases, these are things that will also be recommended as part of that surveillance. I did want to touch on side effects as it comes to statins as well. So again, this is medication that many, many people are on, and I feel as though, when you have lots of people on medications, you sometimes hear about the bad things, and in certain circles, for whatever reason, statins have gotten kind of a bad rap. And I bring this up because I think it is important to know that there are side effects that can occur, and I'd say the most common thing that I kind of counsel people about is just to watch for muscle aches with statins. So probably about 1 out of every 10 people may experience these, and in general, it tends to be more of an unexplained kind of soreness in the larger muscles like the legs. So this is an important thing to be watching for, and if you experience it, definitely letting your care team know. Typically what we would do is kind of take a trial off, see if it improves, and in many cases, if it is a case where someone could benefit significantly from being on one of these medications, oftentimes we'll try a lower dose of the same statin or even a different statin, and in many cases, people are then able to tolerate them. So, if you worked out yesterday and you're sore, probably not your statin. Again, kind of putting this into context of more of the unexplained types of soreness, but definitely things that we do want to be watching for. All All right, so as far as aortic aneurysm medications, that's what I'll kind of leave things at there. And in general, these are medications that many people are taking for other reasons already, even when this aneurysm is discovered, but definitely going to be important pieces that can help to reduce some of that risk. But what we'll kind of dive into for the remainder of the talk here is looking more, again, at valvular disease. And so when we look at the aortic valve, as we've heard from some previous speakers, there can be a number of issues with this valve. There can be issues with opening of the valve, with closing of the valve, or with certain types of congenital heart valve defects. And in any of these cases, when things become more severe and it's leading to symptoms, typically the management is going to be looking at replacing that valve. And again, from a big picture view, the two main types of valves that we're looking at are going to be either mechanical or bioprosthetic or tissue valves. And as we'll talk about, as it relates to medications, the type of valve that someone has is going to dictate a little bit of what we recommend. And so the reason why we start thinking about medications in this valve replacement population is because when we have a valve replacement, there is a possibility for a clot to form on that valve. And if that happens, if that clot essentially gets pumped out and goes up to the brain, that's what could cause a stroke. And so with that, with any of these valve replacements in the aorta, generally we're going to be recommending some form of a blood thinning medication just to help reduce that risk of stroke. And as long as these medications are being kind of taken and prescribed as recommended based on the valve, the risk of this stroke occurring following a valve replacement tends to be very, very low. But as we talk about these medications, really kind of two main families that we'll touch on. So first we have antiplatelets. This would include just your over-the-counter baby aspirin, as well as some other prescription medications, clopidogrel, ticagrelor, or prasugrel. And then we also have anticoagulants. So with anticoagulants, these are a little bit of kind of stronger blood thinning medications. If you guys have heard the term DOACs, this is some of our newer agents like apixaban, rivaroxaban, and then also warfarin, which has been around for quite some time, and what we'll kind of spend a little bit more time talking about because it is a little bit of a more nuanced medication. But when we look at the type of valve replacement, again, our recommendations are going to be a little bit different depending on what type of valve it is. So with these mechanical valves, one just kind of general piece with them is that they do tend to have a longer lifespan than the tissue valves. But the flip side of that is that they do tend to be also kind of a higher clotting risk. And so for anyone who's having one of these mechanical aortic valve replacements, generally this is going to be something that requires lifelong anticoagulation with warfarin. And I bring up here too, so the DOACs, these kind of newer anticoagulants, are not going to be recommended in this population. We have evidence that's shown that there's basically are worse outcomes with people being on these DOACs. So for mechanical valves, really warfarin is going to be our go-to option here. Now with the bioprosthetic or tissue valves, because these are kind of lower clotting risk in general, for most cases, just being on an antiplatelet like low-dose aspirin is going to be sufficient for this stroke prevention. There are some circumstances where warfarin or another anticoagulant may be recommended, with either initially right after the valve replacement over the first several months, or if there are more complications related to different types of thickening with the valve. At this point, warfarin is, of those kind of stronger anticoagulant medications, is really the one that has kind of demonstrated the most evidence. But this is an area with the tissue valves that we do have some ongoing studies looking at the DOACs in cases where something else may be needed. So more to come in that area. But again, in most cases, we are looking at warfarin when it comes to one of these anticoagulants following a valve replacement. All right, so when we talk about blood thinning medications, as you might expect, most common side effect and thing that we're kind of watching for are certain signs of bleeding. And so, things like bruising more easily, getting a cut, taking a little bit longer for that bleeding to stop, those are things that are very much to be expected and really the most kind of common sources of bleeding that we tend to see with these blood thinning medications. But the things that we do watch a little bit more closely for and monitor for are more of these kind of signs of bleeding in places where there shouldn't be. So blood in the urine, black tarry stools, head injuries, all things that would be more cause for concern. And with head injuries, that's kind of an automatic ticket to the emergency department if the someone is on medication like warfarin or an anticoagulant, just to be safe and make sure that there's no bleeding occurring in the brain. And so with that, certainly with being on these blood thinning medications, we do try to encourage being a little bit more careful with activities. If you see professional athletes, when they're on blood thinners, generally they're out for the season, and that's because we want to limit any sort of kind of unnecessary or kind of contact that could lead to more of these injuries. But to kind of close here, the last piece I wanted to just talk more about is this medication warfarin. As you saw, I mentioned this a number of times as we look at kind of the post-valve replacement regimens. And warfarin in itself is just kind of a unique medication because its effects are impacted by a lot of different things. And so if all of us in this room were taking warfarin, we would all need to take probably a slightly different dose in order to get that desired level of blood thinning, just because it is so unique in being affected by so many things. And so with that, there is actually a lab value that we check called the INR that is kind of specific for people on warfarin to look at that level of blood thinness. And when first starting warfarin, this is a lab that we do need to check fairly regularly, even a few times a week. But once we start to kind of figure things out and we see what that kind of proper dosing is going to be, over the longer term, and when people are stable on this medication, it tends to be something that we're okay with checking every month or so. But to speak a little bit more about some of the things that can impact warfarin, so diet is a huge piece here. So warfarin acts against something called vitamin K, which is part of kind of our body's clotting mechanism. And by doing this, basically vitamin K is something that is basically present in a lot of the foods that we eat. In particular, when you look at things like the picture here, a lot of our green leafy vegetables, so spinach, broccoli, kale, things like that. A lot of times I think people get the idea that with being on warfarin that you can't eat those things. And although you can use that as an excuse if you want, that's not necessarily the case. It's more that we want to be consistent with these types of foods that people are eating. And from week to week, if people can stay relatively consistent with them, then we're able to kind of adjust the warfarin dose to accommodate for that. Another big thing that can impact warfarin is other medications. So when we look at medications, there are some medications that also have blood thinning properties of their own. A big example of those are what are called NSAIDs. So this would include over-the-counter medications like ibuprofen, naproxen. And so in general, when someone is on one of these anticoagulants like warfarin, these are things that we generally will recommend avoiding just to try and minimize any further risk of bleeding with that combination. Supplements also a type of medication that often have blood thinning properties to them. And so this is something oftentimes we're looking at kind of risk versus benefits, but looking if there is a potential additive bleeding risk, oftentimes things that we'll be trying to maybe steer away from. Now, there are also medications that can either increase or decrease levels of warfarin. Big example here is antibiotics. So even with a short course, a lot of antibiotics can have fairly significant effects on warfarin levels. And so this is something that kind of take away with all of these points is that, for anyone on warfarin, it's just important that with any changes in medications, so stopping, starting anything new, whether it's prescription, over-the-counter, supplements, or substances, as I note on here, things like cannabis, tobacco, alcohol. These are all things that can impact warfarin, so just important to be communicating any of these changes with the warfarin clinic so that they can be adjusting and probably checking this INR lab more frequently to kind of accommodate for that and make sure that we're able to manage it safely. All right, so to close here, I think it's my last slide, but to talk a little bit more about supplements that I had kind of mentioned on the previous slide. So this is something that I think in all kind of sectors of healthcare, we've been seeing just a boom in kind of usage of over recent years. And when we think about supplements, one of the challenges that we have is that unfortunately we don't have the level of regulation for supplements as we do for our prescription or over-the-counter medications. And so there have been cases where there are certain contaminants and unknown things being in these supplements that aren't actually listed on the bottle. And with that, especially with warfarin being impacted by so many different things, this certainly could be a cause for concern. And so, one takeaway from this is that I tend to be more of a minimalist here, that if there's not a great reason and a clear benefit of taking a supplement, Generally, especially with being on a medication like warfarin, something I might steer more away from. But if there are supplements that people are taking, something that I definitely do recommend for anyone taking supplements just in general is trying to look for one of these organizations' kind of seals that are listed on the slide here on the bottle. So basically, these are organizations that look at what's on the label and what's actually in each pill, and they just kind of ensure that it is what it says it is and that there aren't additional things included as well. So this is just another way of kind of having some of this regulation in place. And the USP that's listed on the top, I'd say is probably the one that's most commonly seen, but just another kind of good advocacy type thing to be aware of with that. And the last thing on here, so vitamin K is something that also is in a lot of supplements, things like multivitamins. It's also in certain protein drinks. And so just being aware of that as another source in addition to some of the dietary vitamin K, just to be aware of as well. All right, so I know that was kind of a whirlwind, but to recap, so aortic aneurysm management, generally when we think from a medication standpoint, we're looking at blood pressure control and potentially looking at statin medications as well, kind of addressing that plaque component. In terms of aortic valve replacements, these are kind of scenarios where we are going to be looking at some sort of a blood thinning medication in terms of long-term management. And then warfarin is sort of this nuanced medication that is going to have a little bit more kind of going along with it. And certainly as far as factors, I know this can be a little bit overwhelming, kind of hearing for the first time. But I'll say too that with that, it is something that as people are kind of familiar with this information and able to kind of adopt things in their lifestyle that are kind of conducive to this, as long as we're able to keep this lab value within our target range, it is a medication that can be used very effectively and safely. So hopefully this was helpful just to give you a little bit more of an overview of these medications. I'll also be around for the Q&A session later and love to answer any questions that people have, so thank you.